Hello, everyone. My name is Dr. Bonnie Key, and I'm the Editor-in-chief of JACC CardioOncology.
Hi, everyone. My name is Dr. Tiffany Powell-Wiley, and I'm an investigator at the National Heart, Lung, and Blood Institute at the National Institutes of Health.
Tiffany and I are sitting here together at the ACC Advancing the Cardiovascular Care of the Oncology Patient course. And Tiffany just gave a fascinating talk on disparities in care in our cardiovascular patients and oncology patients. Tiffany, why don't you tell us, what are the top 5 takeaways from your session today?
Oh, thank you so much, Dr. Key, and thank you again for the opportunity to be here. What I really wanted to convey with the discussion today were some key things. First, of course, that we know that disparities exist in cardio-oncology, particularly related to outcomes in cardiotoxicity and cardiovascular mortality in patients with cancer. And then we know that these disparities are particularly evident amongst Black patients and Native American patients. We have good data to show that these disparities exist. We also have evidence that social determinants of health, particularly neighborhood factors, play a key role in adverse cardiovascular outcomes in oncology patients. But one of the big things that we needed to understand is that there's much more work to do in identifying what these social determinants are and looking at factors, both contextual factors within the food environment and related to social needs, but also more psychological factors, things such as depression, anxiety, how those relate to outcomes in cardio-oncology patients. And then, of course, when we think of strategies, we want to think of things such as how are we incorporating screening for social needs into the clinical setting and really work towards making that more of a standard of care in not only screening, but also in providing resources related to social needs. But much more work needs to be done to really think about what these multi-level interventions will look like for patients in the cardio-oncology space.
Absolutely. I couldn't agree with you more that more science needs to be done in this area. And JACC CardioOncology, we are trying to inspire and motivate science in this area with a call for papers on this really critically important topic. I just want to take a little bit of deeper dive into some of the things that you talked about. We know, you're absolutely right, we know that these disparities exist according to self-identified race. How do you think the epidemiologic data can go deeper to try to identify how or why are these disparities occurring?
Oh, that's an excellent question. So as we tried to highlight recently in a review looking at social determinants and cardiovascular disease, some of the biologic mechanisms by which social determinants and psychosocial stressors really get under the skin to lead to the development of cardiovascular disease. And many of those pathways need to be looked at for patients with concurrent cancer and cardiovascular disease. And so we know, for instance, that the sympathetic nervous system and the HPA axis are activated in the setting of stress. Well, and we know that those have a role in affecting immune cells and immune response. What we need to have a better sense of is how does that affect cancer outcomes for our cardio-oncology patients?
Absolutely, absolutely. And in your talk, you very nicely laid out multi-level strategies, and one of the things you talked about was screening. What we as clinicians can do in the clinic now, screening. Tell us a little bit more about that, what strategies we can use.
Yeah, sure. I think the screening piece and really screening for social needs within the clinical setting is a big thing that we need to really make standard in our clinical care workflow. So there are tools that exist for screening. For instance, the Centers for Medicare and Medicaid Services have developed a health-related needs screening tool that can be used within the clinical setting and can be incorporated into the electronic health record and can be used to screen for things such as financial strain, for needs around education and health literacy, for medication needs. And those are things that we could do right now to really bring those into our clinics and connect patients with social workers or case managers who can help in providing, connecting them to resources.
That was going to be my next question, like who are our best partners? Because it's going to take a team effort, undoubtedly, and also on a health system level too, right? I mean, who are our best partners?
Absolutely. So I think within the healthcare, healthcare system, really providing those integrated teams who take care of patients. So as a clinician working with case managers or social workers, but also having healthcare systems provide resources for community health workers or patient navigators who can understand what resources exist within communities and help connect patients to those resources. That's going to be key. And so we know that healthcare systems have some obligations, even based on Medicare funding, to do health assessments within communities. And so using the resources that they identify and connecting patients to those resources will be important to address their social needs.
Yeah, absolutely. And just in closing, I think last question, the concepts of psychosocial stress and resilience and strategies to equip our patients, just what are your thoughts and perspectives here about what we can do in the clinic and as a society, as a community, really, for our patients?
So many of the screening tools that exist around addressing and assessing social needs also include measures of mental health. And so if we're screening for things like depression or trauma, connecting patients to mental health care providers will also be critical to address their needs around mental health and psychosocial factors.
Absolutely. Well, thank you so much, Dr. Powell-Wiley. It's really been terrific to learn from you, and congratulations on all of your terrific work. We look forward to the impact your science will have.
Thank you so much, Dr. Key, and thank you for the opportunity again to be here today.